Hi guys, continuing on through our rotator cuff, right? We did the supraspinatus, we did the infraspinatus, and now we're looking at the Terres Minor. All right, so you see it attaches along the lateral border of the shoulder blade and to the posterior tubercle of the humerus. Right? And its primary function is external rotation. And it works very much in conjunction with the infraspinatus. Same kind of movement. And the other piece that it does, it can also do like horizontal abduction. It helps with this movement. And it also helps a little bit with extension back here, right? But primarily external rotation, right? So the infraspinatus is a little more abduction, supraspinatus is more abduction, and then infraspinatus and Terres Minor a little more external rotation. And you can palpate this one. Just find that lateral piece of your shoulder blade and follow it right over to your arm bone. And you know, there's another larger muscle, the teres major, that's in a similar area, has slightly different function. We'll talk about that one later. But teres minor is really tiny, but very much a big piece, big player in kind of stabilizing the shoulder girdle to move the arm, and then specifically in external rotation. So I'm finding, because so many of us are a little bit forward in the shoulder girdle has slipped this way, and we know that pec minor gets tight, and the trap as it comes to the top of the shoulder blade or collarbone right here, right? Then what we tend to want to do is kind of over externally rotate the arm in the socket and like overwork some of those back there, when we'd rather have the arm hang where it should be and then put the shoulder girdle back so the arm can do internal and external freely and equally, and it's not kind of forced to hold it. I see this in a lot of people where they're just forcing external rotation right in the top of that humerus. And then, you know, we do chest expansion or even pumping in 100 or something, and we're actually getting a ton of stretch and stress right there. So let your arm hang a little more medially, play with that, and think of lifting up your collarbones and gently relaxing your shoulder blades down in that sort of garage door movement that the shoulder blade can do. And then a little more internal rotation of the actual humerus. We're going to get to that in the subscap. And so that the external rotators are actually being balanced by a force instead of always tightening. So this area in here can get pretty cranky and, you know, like that pinky ball idea on the wall, to massage some of that open so you actually have some internal rotation too. See if in fact that rings true for you or in some of your clients, because I definitely see it. And I know I did it to the point of kind of getting a little shreddy in here and like in that bicep tendon, because pulling back a little too much instead of finding the power in the back instead of the rotator cuff. Okay, so even we talked a little bit about the deltoid and feeling how the deltoid has to do something to stabilize so that you could internally and externally rotate your humerus without having to yank on things. So just play with it and see what you think. Okay, next is the subscap. Thanks.